Second white coat. Subscribe and like. Let's learn medicine together.
You know when we think of swelling, right? We usually picture a sprained ankle or maybe some puffy eyes after a long night. But when that swelling happens inside our head, the rulebook gets thrown out the window. Today, we are going to unpack the super complex world of intracranial pressure. We'll dive into why the brain is just a whole different ballgame and why calling it simple swelling is actually dangerously misleading. Okay, first things first, and this is the most important idea to get. Brain swelling, or what doctors call cerebral edema, is absolutely nothing like the swelling you get in your ankle. This isn't just a tiny detail. It's the whole shebang. It changes everything.
So why is it so different? Well, you don't have to look any further than your own head. Our brain is stuck inside the skull, which is basically a fixed, bony box. Your ankle? It's got plenty of room to puff up. But the brain? It has absolutely nowhere to go. So any little increase in volume, whether it's from fluid or blood or the brain tissue itself, it just dramatically jacks up the pressure inside that closed container. And that is what makes brain pressure so incredibly dangerous.
All right, so let's start by tearing down a really common medical misconception. We're often taught that if you have low protein in your blood, specifically low albumin, you get swelling all over. And, that's true for your legs and your ankles, but the brain, it plays by a totally different set of rules. See, in most of our body, a protein called albumin acts kind of like a sponge for water inside our blood vessels. This pull is called oncotic pressure. So, if your albumin levels drop, say from kidney disease or cirrhosis, that pull gets weaker, and water starts seeping out of the blood vessels and into the tissue around them. That's what gives you the puffy eyes or swollen legs. So why is the brain immune to this? Well, it's all thanks to this amazing structure called the blood-brain barrier, or the BBB. You can think of it like the world's tightest security gate, but for your brain. It's this network of super tightly sealed cells that controls every little thing that gets in and out. And it is extremely picky, blocking big molecules like albumin from ever getting into the brain tissue in the first place. And this just nails the core difference perfectly. In your body, the capillaries are supposed to be a little leaky, so your fluid balance really depends on those albumin levels. But in the brain, the blood-brain barrier creates this totally closed system. Low albumin in the blood doesn't matter here, because that protein can't get out to cause a fluid shift. The brain is its own little protected ecosystem. And check this out. Here's a brilliant clinical twist. Doctors actually flip this whole principle on its head to treat high brain pressure. They give a drug called mannitol, which skyrockets the oncotic pressure in the blood. This creates a really powerful gradient that literally sucks water out of the brain tissue and back into the blood vessels. It provides critical life-saving relief. Pretty clever, right? So the crucial takeaway is this. When we're talking about real cerebral edema, we're not talking about low protein. We're talking about something way more serious, like the brain cells themselves failing or that protective blood-brain barrier actually breaking down. So if low protein isn't the big culprit, what is? Well, our second major cause of brain pressure isn't about leaks at all, it's about drainage. The best way to think about it is like a major plumbing problem involving the brain's own fluid, called cerebrospinal fluid, or CSF. You see, your brain is constantly making this clear, protective fluid called CSF. It circulates around, and then it gets reabsorbed into your blood through these tiny one-way valves. But in a condition called communicating hydrocephalus, those drains get clogged up. The faucet is still running at full blast, but the sink is totally plugged. And the sequence of events is simple, but really dangerous. The fluid's being made normally, but it just can't drain. So it starts to back up, just like a clogged sink. This backup makes the brain's fluid chambers, the ventricles, swell up, which then compresses the brain tissue and sends the pressure inside the skull through the roof. And what could cause a clog like this? Well, it's often the aftermath of really serious stuff. Blood from a brain bleed or inflammatory gunk from meningitis can physically block those delicate little drainage paths, and that leads to this dangerous fluid backup. And this leads to a huge diagnostic clue for clinicians. When a brain scan shows both high pressure and big swollen ventricles, the number one suspect is this drainage problem, hydrocephalus. It immediately points away from simple tissue swelling and towards a specific plumbing issue that needs a totally different fix. Okay, so we've covered protein and plumbing. Our third mechanism is more like a traffic jam, but for the blood that's trying to leave your brain. This is what we call hydrostatic edema. It happens when the veins that drain blood away from the brain get blocked or congested. The blood has nowhere to go, so it backs up and the pressure inside the brain's tiny capillaries just skyrockets. This forces fluid to leak right out into the brain tissue. It's a leak caused purely by a pressure backup. So what causes this kind of venous traffic jam? Well, a classic cause is a blood clot in one of the brain's major draining veins. That's called a cerebral venous sinus thrombosis. But it can also happen from dangerously high blood pressure or even severe heart failure, where the whole body's circulatory system is just backed up. Now, what's absolutely critical to understand here is the timing. This is not a sudden catastrophe. This kind of edema builds up slowly, or subacutely. The symptoms often start with a headache that just keeps getting worse, nausea, and swelling of the optic nerve, a sign doctors call papilledema. And let's contrast that immediately with cytotoxic edema. This is the fast, terrifying swelling you see after something like a massive stroke. In this case, the brain cells themselves are starved of oxygen and energy. Their internal pumps fail, and they just rapidly suck in water and swell up. So hydrostatic is a slow leak. Cytotoxic is a catastrophic flood. And that difference is life and death. Finally, let's look at one last process that gets confused with swelling all the time, but it's actually the exact opposite. It's the brain trying to heal itself. This healing process is called gliosis. After an injury, like a stroke, the brain's cleanup crew, these specialized cells called astrocytes and microglia, they spring into action. Their job is to clear out all the debris and then form a glial scar, which walls off the damaged area and provides support. It's a lot like scar tissue on your skin. And again, the key difference here is the timeline. This is not an emergency. Gliosis is a slow, methodical repair job that happens over months, sometimes even years, after the initial damage. It's all about long-term remodeling, not that rapid fluid buildup we see in a crisis. So here's a really easy way to remember it. Gliosis is the healing phase, not the emergency phase. It's a sign of what happened in the past, not a cause of the immediate dangerous pressure we've been talking about. So let's just quickly recap the 4 very different pathways we've looked at. First, low protein pressure. That only affects the body, not the brain. Second, a CSF plumbing blockage, which gives you hydrocephalus. Third, that slow venous traffic jam, causing hydrostatic edema. And finally, gliosis, which is just a long-term healing process. 4 totally different mechanisms, and each one needs a completely different game plan. And this really brings us to our final thought. Telling these pathways apart is so much more than just an academic exercise. I mean, if the problem is a plumbing blockage, you might need a shunt to drain fluid. If it's a clot in a vein, you need blood thinners. Understanding the why directly tells you what to do next. It is the absolute foundation of treating one of the most critical conditions in all of medicine.